Okay, listen, when we talk about trauma, do you really know what we're talking about? And what kind of trauma? Well, how about if we do something about it on the Morning Scramble? As I introduce you to Dr. Mark Salerno, pediatrician, and Kristen Ray, who has so many letters after her name. If we just went through all of your titles, we would run out of time. A wellness supervisor, where?
At Bayless Healthcare.
And you're in pediatric care at Bayless too?
Yes, we work side by side.
Let's talk about trauma. And first of all, let's talk about the difference between physical trauma and emotional trauma. That's something that's confusing to people, isn't it?
I think it probably has some confusion to people. I think people relate best to something that they can see physically. You know, kids got a bruise that, you know, they see that registers with them. But the emotional trauma can be just as significant and even more so.
Well, I know where the bruise comes from. My child fell down. My child was in the playground, fell off the monkey bar, something like that. What about emotional trauma?
Emotional trauma can be neglect, so it can be that kids don't form a primary attachment with their caregiver, or their caregiver isn't able to provide care for them. It could be that they're abusive verbally, so they are really demeaning towards their kids, or cause a lot of pain in that sense. So,
is it always the fault of the caregiver? Is it the absence of something in the caregiver's relationship, or can it also be something built into the child?
I think usually it's that there may not be the tools for that primary relationship. So whether that's the caregiver's childhood history and their own traumas that they've been through, whether that's the environment that they're in. There's a lot of kids are not an island, right? So we have society that affects children, we have families that affect children, schools that affect children. So and all of those systems play together to build healthy children.
Is one more damaging than the other?
I think they can all be damaging. They can also be supportive and healthy.
In reading about what can be a catastrophic thing, that is trauma of either type in a child's life, I ran across a term that I'd never run into before. Protein S100B, is that right?
Yeah, in some places, mostly other countries, Canada and Europe, they've used this protein as a marker for the degree of damage done in head injury cases. What's interesting is someone looked at this same protein in the blood of children who have undergone emotional trauma and found levels of this inflammatory protein as high in those cases as in kids who have had serious head injury, which just tells us what we already know, that emotional trauma, head injury, all of these things are bad for children, and they need some help.
I can understand at least some of the ways that you treat a physical head injury. How do you treat an emotional head injury?
I think you have to really connect with that family. It goes back to what you said, is whose fault is it? You got to try to stay away from the fault thing and fly close to the ground. You know, what can I do to help this family?
Is that what you do?
That is what we do. So we do.
Give me an example of how.
So through cognitive behavioral therapy, we have therapy called EMDR. We have a lot of different kinds of therapies that
You're
help.
You're moving too fast for an Irish kid. I kind of got the cognitive therapy, MDR.
EMDR, so it's a therapy used for trauma as well. It uses eye movements and desensitization, so it's kind of a type of exposure therapy. So there's lots of different modalities that we can use to help treat kids, but like Dr. Salerno says, it's really important to include all of their systems. So using their support systems with schools, with their community, with their families.
Can a child suffer from PTSD?
Absolutely.
For the same reasons that adults might?
Yeah, PTSD is generally categorized as going through something that's life-threatening. So either witnessing or being part of something that's life-threatening. Those are big traumas that kind of give us that title of PTSD. But there's also little traumas throughout people's lives that are chronic stressors that also contribute to a PTSD diagnosis.
Okay, let me create a scenario. A child of 4 is in an automobile accident. Gets some bumps, but that's about it. But the car is totaled and is one of his parents is in the hospital for a while. PTSD can come from that?
Absolutely. You know, it depends how much support that child has around what's happening there. You know, a lot of PTSD talks about events that have happened in the past. So you have to make sure you put that fire out so that that trauma is not still ongoing. But then what kind of support do you give that child? You know, some children will come through that and snap back the next day like nothing ever happened. You want to take care of that child, pay attention to them, but another child, they may be afraid to ever go near the car, you know, for long periods of time, and you need to be more aggressive about helping those children along.
I've talked to service people with PTSD, and many, many times, no one very, very close to them in the family had any idea this was going on until there was an eruption. Can that also be true of a child?
Yes, and those eruptions often happen at different ages, often long after the event has occurred.
Talk to me about treatment.
I think different things start to trigger those events as you move through life. We talked yesterday about how developmental stages will often trigger those events reoccurring. And so when we treat that, we like to look at what are the chronic stressors that that child has experienced throughout their life, and then address the thoughts, feelings, and behaviors that go along with each of those triggers.
Are you optimistic when a family comes in that a child can always be treated?
Absolutely optimistic that a family can be treated. It's getting that family.
I notice I said child, but you said family.
That's
The
right.
family needs treatment.
You can't look at the child, you know, divorced from the family, ever.
You may want to check in at the Bayless Center, and that's the reason why it is that we invited these folks, because they deal with this on an everyday basis. Interesting kind of a transition we make. Wine and chocolate, trauma, and now Jay Leno, only on the Morning Scramble.